Despite years of progress in getting smokers to bud out, 15% of American adults still light up, about the same as in Canada, and those rates have been relatively flat for the past few years. So the new head of the U.S. Food and Drug Administration has a strategy to change that.
Render cigarettes minimally addictive or non-addictive by regulating their nicotine levels. Unless we change course, 5.6 million children alive today will die prematurely later in life from tobacco use.
Cutting the nicotine in cigarettes is not a new idea. Light and herbal cigarettes have been around for years. What's changed is the arrival of a new tool to help smokers who want a nicotine fix. The FDA is gambling that weaker smokes will drive people to e-cigarettes, which are considered less harmful than tobacco.
Even with unanswered questions about the benefits and risks, there are now different technologies to deliver nicotine for those who need it that doesn't bring with it the deadly consequence of burning tobacco and inhaling the resulting smoke.
Research suggests the lower nicotine strategy has promise. And as part of its plans for a new tobacco control strategy, Health Canada is also considering the same move by reducing the addictiveness of tobacco products in order to prevent people from becoming users. But critics suggest if the nicotine buzz from vaping is the same as smoking, more cigarette smokers would have switched by now because it's also cheaper, and that cutting nicotine could make a perennial problem even worse.
Because we have contraband overnight, millions of Canadians are addicted to nicotine. If they can't get nicotine from cigarettes, they'll have to get it from somewhere else, and they will get it from inexpensive contraband cigarettes.
Health Canada's tobacco reduction strategy is set to expire next year. While the government might be attracted to new ideas such as cutting nicotine, groups like the Canadian Cancer Society want to stick to old reliable methods: higher taxes, ad campaigns, and plain packaging. Vic Adopia, CBC News, Toronto.